You're listening to Health Professional Radio with Wayne Bucklar. Today my guest is Kath Mazzella, OAM, and Kath is a director of Mazzella Consultancy and has an interesting story to tell. Kath, welcome to Health Professional Radio.
Yeah, thank you very much, Wayne.
Now, Kath, I understand you're a gynaecological cancer survivor and you've been working now with education in that area.
Well, not necessarily education. I call it awareness because I don't have any degrees or any qualifications in that area, just a simple life experience. Well, not quite simple.
So tell us the story.
Okay, well, 20 years ago I had a radical gynaecological cancer. In actual fact, I had my clitoris, vulva and lymph glands removed, and it was just so traumatic to sort of think I knew nothing about down there. And I basically left my information with my doctors and gynecologists because as a busy working mother, I didn't have time to learn about these things.
And I guess that's a reasonably common experience.
Well, it is, because women are just so busy, twice as busy in this day and age. They've got to be working and taking care of the family, and there is no time to learn about your health. But everybody says, well, you can go to the internet, and we learn from the internet. But I would still like to see a lot of the gynecological health issues starting even from age 14, and a lot of people don't relate to 14-year-olds and gynecological health, but a lot of complications can start when a girl first has her periods, and yet we don't seem to talk about those things in society.
No, in fact, periods are one of the things that kind of get euphemised and mentioned with ads for menstrual products on television, only in terms of joyous and happy occasions.
Well, yes, it's very interesting how that we can accept ads on television that we do use these apparatus, whatever you call it, but it's like this, but we don't talk about it in a community environment. And yet I've noticed 1 million women have got polycystic ovaries, 1 million have got endometriosis, plus all the other gynecological conditions. But a lot of those conditions can start when girls are 14. But what do the parents know about this to support these young girls? And I just think it's time that we have to go back to square one and just sort of build on it from there, because I just think it's totally amazing from what I've experienced and how women's organisations seem rather reluctant to even address some of these issues, but it's some of the very things they stand for, and yet the stigma and the connection between the sexual relationships but the mental impact of these things, it's unbelievable that we still live in a society as we do today, especially when we're such a sexually promiscuous society, and yet to talk about the effects of that. I've actually have an undies campaign for my International Gynaecological Awareness Day, but a lot of people still are quite put off to sort of think that you would connect undies with gynecology. They're just cardboard cutout undies. But you think, well, what's the problem in it? You know, we have bras for breast cancer, and breast cancer have done an amazing job with their marketing and the bras and acceptance. And I guess in society that the breast is totally different concept than gynecology. But as a woman, I feel quite offended that it is still like that in this day and age, that gynecology has this ooze factor. And people say to me, we'll call it reproductive health, and then the society might accept it more because that's about having babies. But gynecology is definitely not about having babies.
Yes. And I heard you mention there an International Awareness Day. Is that one of your initiatives?
Well, it is one of mine because I had to find a way. I mean, I've followed on what the breast cancer women have done, and they have a day and they all come together, and I thought, well, what can I do for gynecology? So I'm pleased to say King Edward Memorial Hospital for Women in Perth have celebrated the Gynaecological Day for the last 3 years, and they have an in-house staff competition who can design the best pair of undies, and the Lord Mayor of Perth, Lisa Speedy, who supports my work to the hilt, she came and judged the best pair of undies. So we've already paved the way to show how it can be done. It's not rude, it's not offensive, and it's just a fun way. But you see, I want to get this out into the community with the women on the ground level, not just in hospitals, but just to get it out there to break the barriers and the stigmas and show that there is life behind gynecology.
Yes, and 95% of our audience, in fact, are the clinicians working in hospitals and in aged care facilities. Is there a way that they can help to get the word out on the street? Is there a message for them to take away from you, having heard you today?
Well, I have had a female gynecologist, a colposcopy. She does all the colposcopies here. She celebrated the Gynae Day this year, and she had 50 pairs of my undies there, and she got the doctors and the patients to all come in together, and they were designing their own cardboard undies with the lace and ribbons and things like that. But she also has some extras, and she gives them out to some of her patients, which is like, take this time. And so by doing this, you see, I find it's a bit of a challenge for doctors when a woman goes with a gynecological problem, that the doctor then has to teach the woman about gynecology and which bit is which is a double pressure on a doctor to be able to, to educate and take care at the same time. And to me, if a woman went in there empowered with the knowledge and confident with what she's talking about, well, then it makes it for a greater world for the medical professionals and for the women themselves. So, there's a lot of work to be done, but it really isn't hard work to get this out there, but it's still a challenge to change the mindset of society about what belongs below the belt, What is this stigma about, and where does it come from? And I discovered the word pudendum in the dictionary, and the last version of that word is female genitalia, one who should and ought to be ashamed, the shameful part of a woman. So I guess we're talking about the vulva there. So most women think their vulva is a vagina, and to me, I have been told medically that they're completely different, and I know they're completely different parts of our body, even though it's still classed as the genitalia. But I just wish that, we as women can use the correct terminology and say it for what it is, because I don't think women understand we do have this shame. A lot of women think, no, I don't have a problem with it. But, I just think there's a lot of issues that need to come out to have the greater acceptance in the community.
Well, let's hope that as a result of chatting with us today, Kath, we'll get that message out a little bit. Now, if people want to get in touch with you, what's the best way to do that?
They can go through kathmazzella.com. It's KathMazzella.com.
And I'm always getting into trouble for not letting people know that I'm going to give a website, so fair warning, pencils ready. That was Kath Mazzella, KathMazzella.com, and you can get hold of my guest, Kath Mazzella, there. Kath, it's been a pleasure having you on the air with us this morning. Thank you very much.
No, it's my pleasure, and thanks for the opportunity.
If you just missed my chat with Kath Mazzella, then the good news is we have a transcript on our website, and we also have an audio archive on YouTube and SoundCloud, and links to both of those are on our website as well at www.hpr.fm. My name is Wayne Bucklar. You're listening to Health Professional Radio.